My name is Tom Philpott. I'm the Executive Director for the Community for Excellence in Health Governance, more commonly known by its acronym CAG. And I'd like to welcome you to this, our second webinar, and our first with the Health Council of Canada. And we're proud to be hosting this webinar, which marks the launch of the Council's newest publication, A Citizen's Guide to Health Indicators. And this report is of particular interest to us for two reasons. Firstly, we believe that performance measurement is going to become increasingly important in the eyes of the public as both quality and sustainability issues move to the forefront of the health agenda. And secondly, it is critical that boards have a good understanding of health indicators in order to effectively carry out their work. And our new web portal located at pilot.myhealthboard.ca permits all of us who are working in and leading Canada's 14 different health systems to connect, share challenges, resources, tools, and find solutions. And we're going to be employing this after the webinar to continue the discussion. So leadership and governance, we understand that they're key to moving forward. And since 2007, when CAG was formed, we have been providing web-based resources to help boards become more effective. And we facilitate the administration of paperless meetings with partners. Our burgeoning membership now includes some of the most prominent health providers and authorities in Canada. Our work involves partnerships with important pan-Canadian organizations. You obviously know about the Health Council of Canada. And there's also Canadian Patient Safety Institute, the Canadian Health Services Research Foundation, the Canadian Institute for Health Information Accreditation Canada, the Canadian Healthcare Association, CHLNet, Health Canada, and once again, Health Council of Canada. So you can read more about this at pilot.myhealthboard.ca. Now, before I introduce John Abbott, the CEO of the Health Council of Canada, I would like to underline that this webinar is only the beginning. As those of you who are already familiar with how we work, the conversation will begin with this webinar, and it will move online, where we'll continue over the coming weeks. And people working in all parts of the health sector, primary long-term care, home care, mental health in hospitals, they'll be sharing their experiences with indicators. I'll tell you a little bit more about this at the end of this webinar. So we want to hear from you, and this is your opportunity to ask questions, share challenges, and exchange solutions. So not only can you send in questions throughout the webinar, but you're invited to participate afterwards. And health indicators are, after all, they're a challenge for most of us. And it's not one person or a small group that's going to be able to provide solutions. It's really as a community at large. So now I'd like to introduce John G. Abbott, the CEO of the Health Council of Canada. And John has much experience in bringing about change and needed improvements in healthcare. Prior to joining the Health Council, John was Deputy Minister of Newfoundland and Labrador's Department of Health and Community Services. And in that position, he oversaw the reorganization of the province's system of regional health authorities and the expansion of the provincial drug program to meet the needs of low-income families and those with high drug costs. For the course of his career, he worked to improve health services, community services, housing, public works, and transportation. So all of these have a strong bearing on health. And he may not be aware that we've taken a look at his bio and we've noted not only his interest in heritage property redevelopment, but that he recently hiked Africa's Mount Kilimanjaro. So we hope that he finds this webinar a little bit less onerous than that trek probably was. You will be hearing from me again, as I mentioned, during this hour, and I'll join John in discussing indicators as well as at the end of the hour when I'll give you a brief tour of our web portal so that you can see how easy it is to participate in the post-webinar conversation and read the blogs and such that will be posted there. And you might even find one of them from our distinguished guest. So now I'll turn it over to you, John Abbott.
We've done the introduction, so I'll just move forward here. Our document that we put out today is called A Citizen's Guide to Health Indicators, a resource for Canadians. We were established in 2003 as a result of the First Ministers getting together to talk about the future of healthcare in Canada, and as part of the agreement, they set up the Health Council to really monitor and report on the progress of healthcare renewal in Canada. There was obviously significant investment by government, and there was an interest at long last to see that, in fact, the renewal agenda was taking hold, and our job was to let Canadians know how progress was unfolding. And secondly, we've been focusing on disseminating information around best practices and innovation in healthcare design and delivery across the country. and that's something we will be doing more of in our future work. Our goal, I think the goal of all of us involved in healthcare in Canada, is to look at how we can improve access to healthcare services in this country, that in fact we deliver high quality care, and overall that it is sustainable for both now and for the long term. And I think that's something we'll be hearing a lot more of in the days, weeks, and months ahead. Again, our initiatives here at the Health Council are focused on both public reporting and engaging Canadians, health providers, health system planners, policymakers in the healthcare programming and renewal initiatives across the country. And this exercise today here is certainly one of public and clients as well as provider engagement. We do most of our work through public reports. The guide is an example of the type of work we do. We're certainly being more into the social media area now in terms of podcasts, blogs, tweets, to get our word out and to certainly get input from a broad section of Canadian society. So why a Citizen's Guide to Health Indicators? Given that we as the Health Council don't develop or calculate health indicators, why have we developed this guide? And really it came about when we were looking at one of our mandates here at the Health Council was to report on health outcomes across this country. We had to determine what in fact are the resources in place to help us report, but also to help Canadians understand the topic. So we decided that we really need to get to the basics. We need for decision makers. We know this is a critical part of the work they do in terms of health policy analysis, and public agencies are certainly developing and issuing health indicators. But our experience and our research tells us that in fact they are underused, underutilized in our work, and we need to understand that. For the public, we know that health literacy is a critical important to help Canadians in understanding and contributing to their own health. And we wanted to develop this guide as a resource for them so they can be, them being we, become better engaged as patients and citizens in our health services. And for clinicians, probably those amongst us are using indicators the most, but in their communicating to their patients, are they communicating so that the patient in fact understands what in fact he or she is talking about? I'm, for one, am interested in cholesterol levels, and I know what my provider tells me and talks to me about. But some days I'm wondering, do I clearly understand what the messaging he's providing to me on how I improve my health? And I suspect that's true for most of us. Secondly, I think for us, this guide is to provide some of the basics around health indicators as health statistics and the context for how they're developed and how they can be used. And we believe we all can learn by getting a better understanding of what an indicator is, how it's developed, and how it is used. This guide consolidates more resources for the reader to further explain and to use indicators. We provide links to what we're referring to as cool tools to enable the reader to use indicators online. And we provide some vignettes called Indicators at Work to illustrate how they are developed and used. There are 3 provided in the guide, and we've posted a 4th. And we know there are many others that we'd like to see developed and used. So in the presentation today, we've just showed the cover of our guide to introduce the Citizens Guide. We'll provide some highlights of the guide, focusing on the basics and the challenges in using health indicators. And we'll get into where do we go from here, followed by a Q&A. So what are health indicators? I think simply we can refer to them as high-quality measures of health, healthcare, and the determinants of health. So it is a form of measurement. We can use it as a tool to understand the issues and trends in healthcare, health system delivery, health performance. And ideally, I think we'd like to see health indicators reach the same literacy within the Canadian public as the unemployment rate, the consumer price index, the TSX, you name it, that help us monitor the economy and where we see things developing on that front. And do we have common health indicators that, in fact, allow us to rate the healthcare system and our healthcare? And we use the analogy of using health indicators like a CARES dashboard. They can help gauge the population's health, the performance of our healthcare system, and through that we can monitor what's happening, reassure us that certain things are in fact going the way we want, and they can warn us when things aren't going well. And if anybody saw CBC's news last night with Jack in the emergency room in the Hamilton Hospital, they used very good indicators to measure the performance of for wait times in the hospital setting. So why do we need them? The health indicators allow us to make comparisons among many things. Certainly among and within sectors within the healthcare system. We can look at emergency room wait times, and we can also look at the performance of emergency room and use of beds within a hospital compared to other bed utilization in a hospital. Obviously looking at health performance over time periods. So are we in fact improving the delivery of services over time? How do we judge that? Well, we would look at the health indicators as we measure them from time to time. And population groups. So, for instance, if we're looking at the prevalence of diabetes in the Canadian population, we'd want to know how different provinces are rating, and within those low or high incomes, our Aboriginal population versus our white southern population. So we want to use indicators to help us to make those comparisons. We see them increasingly being important for performance reporting and improvement within the hospital system. The Ontario and BC governments are certainly focused on that area at the present time. In terms of program planning, we use as an example chronic disease. Once we know through better indicators the prevalence of chronic disease in which populations, we can certainly do better programming on a provincial, national, or local basis. Certainly a significant issue in Canada, and reporting on more often now, is around health equity. And we are seeing as the economy changes, evidence of health inequities or inequalities seem to be emerging, and we need to get a better understanding of that and allocate the appropriate resources to address that on a go-forward basis. And really, indicators help us to improve accountability and public reporting on the performance of our healthcare system. And we see the health quality councils across this country are doing a lot of work in this area. So what is a good health indicator? One, it has to be useful. It helps answer an important question. So when we look at wait times or trends in disease prevalence, the good health indicator would be able to pinpoint for us the areas that we should focus. And in developing wait times in sort of the 5 key areas in Canada, we certainly were able to use research around and use of health indicators to determine what in fact is the appropriate wait times for many procedures. It has to be valid, it has to be reliable. In that regard, this is passed through a gauntlet of tests as we have it written here, but it really is technically well developed and meets independent use on an ongoing basis. Obviously, it has to be comparable for use by different users, no matter where they are within the healthcare system or within the health ministries or by the public. So we need standard definitions. We will make sure the risk are age adjusted as needed. The data is available, it is collected and analyzed on a consistent basis. And that is done certainly over time. It has to be well documented. The technical information is available and used. We make sure the definitions, the data sources, the calculations, any limitations are clearly defined and understood by the users. And so in that regard, that information has to be transparent to all of us. And when one has technical questions, we need to know the source of the health indicator and the statistics that make that up. And we certainly recommend, based on our work, that we would go with Canadian Institute for Health Information or Stats Canada, who have the technical expertise to help us. But I suspect we have those also in our own organizations, and the knowledge base is certainly increasing and expanding over time in Canada. And we obviously see a lot of international use of health indicators, and we need to be able to go to those organizations as well. So what do health indicators tell us? Well, it tells where we are now, what has changed or not, but it doesn't answer the question why. So when it comes to health status, we do have indicators around infant mortality, body mass index, self-rated health, and so indicators are certainly used and need to be used more to help us determine our health status. We have the non-medical determinants of health. So we do have indicators that tell us about our fruit and vegetable consumption, our sense of belonging, those kinds of, in some cases, more qualitative, but they are also able to tell us where we are on those very important aspects. Income levels, education levels are very good examples, and some countries do an excellent job of bringing those indicators together to tell a story, and I think one country who's doing that well is certainly Sweden. And it tells, health indicator will give us good information on system performance. Wait times, as we say, is a good example. We're seeing a particular focus around emergency room wait times these days. We know about admission rates, in-hospital deaths. All of those give us a good sense of system performance. And we see this as an area where indicators, further work needs to be done in expanding the development and use of indicators. Secondly, community and system characteristics are better understood when we know about the appropriate indicators to tell us what is happening. So, for instance, it's important to know about single-parent families when it comes to defining and designing what are certainly after-school programs that are also helping in the design of wellness programs, children's activity programs. We need to know about the rate of hip replacements to give us an idea of what is happening with our seniors and elderly population. But at the same time, not only that, but we also need to look at what happens to the health of a senior weeks and months after a hip replacement. And we also need to look at health spending, because when we use indicators and compare to health spending, we see that in some categories we are spending significantly high levels of funding for very little, relatively small output, and we need to make sure we have the allocation of resources appropriate. And health indicators help us to engage in those conversations. In terms of equity, again, we need to look at, as an example here, is hospitalizations for injury by income group. But we know in Canada we have quite a different level of health resources allocated to different populations, Aboriginal versus non-Aboriginal, rural versus urban. And our work around health indicators can tell us about those differences and help us address the question why that is. And we need certainly further analysis around any one of those issues. And we have, through the health indicator framework, a set of 80 or plus indicators that have been developed by CIHI, StatsCan, and others. And I think it's a good resource for all of us to look at those and see if, in fact, we think they're the most appropriate, and if there are further improvements in the indicator framework. But that's the basis for, within the healthcare community in Canada, that we use to help frame many of the policy and program decisions by use of those particular indicators. What they don't tell us? Well, health indicators help, as I said, raise many questions. but don't provide the question around why or why not or how. And it can't be and shouldn't be used in isolation to understand a complex health issue. And the ranking of health indicators may be of little use without some benchmarks. We know that there are various reports that are put out that compare the Canadian healthcare system, for instance, with the performance of other countries. Sometimes that is simply done to raise the question, but we have to be careful in how we use that data to advocate for a change or improvements in Canada. And in that regard, we need to make sure we understand the basis of any of the indexes used in those comparative reports, and to get the answers to help us understand, again, in this case, the question, why is Canada doing better or not relative to other countries? We think we're doing the best in most areas. Many reports out now tell us otherwise, and we need to make sure we understand the basis of those the indicators used in those reports before we can advance any particular public position. So there are many challenges in the use of what we refer to here as composite health indicators as they are developed. So we have examples here. We talk about the type of indicator that we need to use to capture intangibles or complexities when it comes to such issues as food insecurity, quality of life, quality of care. So one indicator is not going to give us certainly all the answers, and we have to be careful in how we use indicators and how we as readers and users of those interpret them. And I know any Minister of Health will be using indicators in his or her work, but also will be subject to responding to different reports that use one or two indicators to capture their attention on a particular issue. We need to be able to consolidate, excuse me, and roll up numerous, not only the indicator, but other factors to give us the big picture. So when we talk about diabetes in Canada, we obviously can we have developed indicators around diabetes, but we need to understand why it's still prevalent, why it's prevalent in our younger population as time moves on, and why it's prevalent in our Aboriginal population. What are the other factors that make up the big picture before we can advocate for improvements? And at the same time, we may need to be able to unpack the indicators and the specific issues around them to, in fact, make and take action. So we have to be very comprehensive in our approach, but at the same time, we have to be selective from time to time to allow decision makers to understand the issue. Smoking is a good example where we know there are many factors that make up the reasons why we have smokers, but we also know that we have to be able to address that on a population and age cohort so that we can take the appropriate action for each segment in our society. We have many burning questions, many wicked questions around healthcare and the performance of our health system, and the comparable indicator may not yet exist. Homelessness is a good example where we have different data around aspects of homelessness in the community, but we are having trouble at this point comparing community to community, province to province in that particular sphere of public policy. Prescription drug use is an example where we used in recent reports. We know what drugs are used. We know who's using them. We don't know why and why the significant prevalence of a prescription drug use in this country and why it varies significantly from province to province. We would some days think we have a homogeneous population for the most part, but in fact when you look at prescription drug use, it varies quite widely. Yet we know some of the basic indicators, but not the why. And our indicators being reported on consistently. We have some indicators such as wait times, but the definitions are different. The data is collected differently, and we are unable to compare jurisdiction to jurisdiction on a very significant issue of concern to Canadians and governments. And the recent High report speaks to that issue. So we're in an evolving world around the healthcare in Canada and its future. We are in the good state, I guess, of having mechanisms in place to support the design and development of health indicators in response to our needs. And I use at the national level certainly the work that CIHI and StatsCan are doing in this area, but we're seeing certainly at the provincial and regional level across Canada significant improvement in the development and reporting on health indicators. I use the reference here, the community accounts, which are prevalent in the province of Newfoundland and Labrador, which has taken lots of different statistics to put together in a comprehensive reporting out to at the provincial and community level on quite a wide range of determinants of health. And we're seeing the development and maturity, if I can use that word, of our provincial health quality councils and institutes, the Commission in Quebec, who are making significant inroads in reporting to their populations on what is happening with health and healthcare in their jurisdictions. And we know from their work and others, we are seeing an expanding capacity for performance reporting and an expectation by both the ministry level and the community level and at the population public level, a reliance on their reporting to help them gauge the performance of healthcare in their provinces and territories. So in terms of next steps, in terms of ours being the Health Council of Canada, we're embarking now on a review and analysis of the quality of public reporting through health indicators across the country. Our mandate is to address reporting on health outcomes. We feel that we can best do that by leveraging the work of each of the major reporting entities across the country, and we want to look at how they're doing their job in using and reporting through health indicators, and that's a project that we are just commencing sort of as we speak, and we saw the guide as really the foundational piece to help us get to the second piece of work. We're asking of yours, that's the people on the participating in the webinar today, what's been your experience with the sense of quality of health indicators and their use in Canada, how we best exert leadership to ensure we all have and are using appropriate health indicators in our work. Certainly interested in the community board member who, in part of their role, will be, sort of holding the CEO and senior management to account for the performance and what tools do they have at their disposal to help them do their work. And then we've listed off some interactive spaces that we could and would ask people to use to blog around this particular topic. So Tom, I'll pass it back to you.
I did have a question for you, John. I'm wondering, when you're going around promoting the health indicators, a report such as this, what steps do you take at the Health Council to promote this information, to disseminate it amongst the public?
Well, as with each of our reports, we do a sort of comprehensive assessment of potential users, readers of any one particular document. In this case, we felt that there are certainly several audiences for the report, and one of the tools we thought was certainly this webinar to get the information into the hands of people who have a particular interest today, and then to engage them in conversations. We will disseminate this report out to the ministries. We will be posting in through our website, and we will be looking for different opportunities to engage as many potential users of health indicators. In the design of this particular project, we worked with the Canadian Public Healthcare Association, and they were very helpful in framing up some of the issues, some of the examples we use in the report and actually tested the whole issue of indicators with their particular members to gauge how they use them, do they use them, how they could be best used. So it's pretty comprehensive, but we know there's always new opportunities to sort of get and spread the word.
I do have a question here about it was sent to us as a private question because you have that option, and it is with regards to the validity of, or the use rather, of public reporting and indicators, and if there's been any research around that. So I can address that one. We did do a feasibility study in 2009, and it was commissioned by our advisory council. If you want to see the participants, you can certainly go to our site and look at the About Us. And it was commissioned to look into reporting on the health indicators, and it was sponsored by CHSRF. And it was quite interesting. One of the members of our advisory council, he had also worked with the Régie des Rentes, which is the pension organization in Quebec, and they had started using big dot indicators and needed help with that. And so he was very interested, as were some of the other members, in having us look into this issue. And so we did. We looked into the value of public reporting, and the results basically is that public reporting is here to stay. However, at the present moment, most of the public reporting, the significant impact ends up being internally for an organization. The actual public is not using the information in the manner in which one might expect them to. And so it's probably rather the early stages in this, and I do expect that within the next few years, and these things usually happen sooner rather than later, then the public will start using this information a little bit more. And there may be other factors around that concerning the way the information is presented and the access to the information and such. So I suspect that we're going to see some changes around this issue, and it is a very important first step on the Health Council's part. I'm not sure if you've done any other reports on this, John, but you can certainly comment on that. But in getting this indicator guide out there to the public.
Different reports we refer to indicators, but this is the first time that we've really taken this in a sort of a comprehensive way, and then tried to build on this. I see there's a question there in terms of from Maud in terms of are there any source of reliable, validated indicators related to the social determinants of health? There's some work being done in different quarters on that. The area that our source for that data would be the Public Health Agency of Canada, and then they would be relying on obviously work at CIHI and StatsCan and any of their own work. That's all I'm familiar with sort of at the present time.
Very good. There's a discussion that I had last week that was quite interesting on the topic of indicators and such, and it was with our member advisory group, which is representatives from each of the member organizations are welcome to have representation on this advisory group, and it gives us an idea of member needs and helps us connect members together and such to help support each other. And we had a discussion on indicators that just happened to flow in that direction, so obviously it's on people's minds. And there was concern about having indicators that aren't in the acute setting, so related again to Maud's comments. And it was also looking at indicators that might help us follow a patient along the continuum of care. And I've heard this discussion on in a number of different parts of the country, and so it certainly is very important. There was an RHA executive in the Atlantic provinces who was talking about the difficulty of finding the right indicators outside of the acute setting, and a community and the executive director from a community group in Ontario, a community health center, talking about the difficulty of identifying indicators as well. And I would certainly be interested, and I'm sure John would as well, in having webinar participants to contribute to some of the sharing of thoughts and information on indicator development, particularly outside of the acute setting, and with regards to continuity of care. And I would be curious if there was an interest out there in doing something like this.
There's a question here from Peter who asks, bring to our attention some of the work in Sweden. He refers to the Gapminder software. And Peter, I can't say that I'm familiar with that particular piece of software, though I am familiar with their reporting at the national level in terms of their quality and health focus, and some very good work there, and I think could be used in Canada, certainly at a provincial level, if you were to compare population and geographical sizes. But also, I think at a national level, they are able to pull together both health and health system and some social determinant factors, and to break that down on a community level. And I think we need to be moving in that direction if we were to make some of the inroads with many segments of our population in terms of health promotion and health quality.
John, I see a question here from Wendy Nicklin. She's asking, what input did the public have into the content of this report? The question is, what does the public want to know? What is relevant to them?
Well, Wendy, thanks for the question. The only, I guess, the area where we focused on at this point on this particular document is that we had different readers of our drafts to help us frame up the report and to make it hopefully user-friendly and relevant. But we didn't do any particular engagement to tell us around the specific topics to be covered. It was developed based on, I guess, what we've known to date. And that's one of the issues and questions we want to put in front of our next piece of work, is when we look at how jurisdictions report out, how relevant are the reporting for their publics. And we know that some of the provinces have done work in engaging their citizens on these issues, and we want to see how the two sort of components connect. So that's something will guide us in our future work.
There is that we're going to run out of time here if we don't have a peek at this section now, where we're showing people how to use the online resource to continue this discussion. We can actually type up and post these discussions there as well and answer them in that space. John, do you have any further comments to make at this point before we do that?
Well, just in relation to one of the questions here from Susan, which talks about the relationship between certain indicators, and is there any resource or research that assists us, any one of us, I guess, in choosing the related indicators? And we believe that that's really the crux of the going forward around this particular topic. And we got into this because one of the things when we looked at health indicators, yes, we can do the list, and as some said, there's lots of tables and lots of numbers, and but very few conclusions. And how do we make sense of the indicators that are there? Are they the most relevant in guiding our work wherever we are in and around the healthcare system? And I think that's really the challenge to every one of us, is to figure out how we use these best at whatever level. So my experience as a former deputy minister is I need to be able to rely on the work of others and then consolidate this down to very fine points for ministers who would sit around a cabinet table to make policy and budget considerations. And my job would be to make sure we had the most relevant information in front of them, as well as then get into the political considerations, what have you. And that's the challenge, and I think that's where we need to stay focused as we move forward with this agenda.
Thank you very much, John. So what I'm going to do now is I'm going to very quickly take you through the portal that we've been working with. It's a pilot portal that's just about to enter into the mainstream, but you're certainly invited to join the discussion there, and you should have received, if you haven't already, you'll be receiving it shortly, an invitation to do so. And so I'll give you a quick little tour of it. This is, for example, if you're using Gmail, this is what the invitation would look like. Say, welcome, you're going to have a username and a password. And then you would go to the address, so pilot.myhealth4.ca, and when you're on the when you're at that point, you would then go over to the login, and you would log in up at the top. You see the login area, and this would take you to the landing page, what's called the root community. So this landing page is it takes information from the resource center, which is right here, the lounge area, which is right here, and it will the meeting management service is being offered right there. It's just coming live now. We're interested most right now in the lounge. So the My Office is where your personal preferences would be set. And you can also go to the top of the screen, and you can go down to Profile down here to get to the Office area. And that's very important in terms of editing and changing one's profile. And the complete profile is very important to have, because then you've got someone's picture, so you can get a little bit of a better feel for them, and you can have a bio information when you click on them, and you'll know a little bit more about who you're dealing with, which is a comfort to everyone, I'm sure, and they'll be more comfortable with you as well. So because it's people from all across the country. So I'm going to show you very quickly the search engine. Up in the top right, you can type in something such as quality. You'll get a quick list of results. And then for a more complete one, you actually enter. And then you've got a list of people who might be interested in quality issues, and as well as a list of the different items that came up in the search results. And so now we're going to take a quick look at the Resource Center. There's two main areas, Canada's health system and health governance. And I invite you to look at this. There's some terrific material in the repository. We've got some great material on quality and such. You might see the layout of the Resource Center changing a little bit. We've come up with a new layout. And actually, if you go to the Resource Center before you log into the site, you'll see what the new layout's going to look like. So navigation map. Here we're taking a look at the lounge again. So you can click on this floor plan at the top, and you'd be taken to the lounge proper. And in the lounge, you've got different lounge areas, different things going on, and different actions that you can take to start discussions and such. And you notice here, Citizens Guide to Health Indicators webinar launch, so a little bit of publicity for that. And there's a couple of different ways, and some of the information, like meters and sites on sites, you can access it from a couple of different spots. And I don't want to spend time going through this because I'm concerned about giving you the full information that you need, but you can see you've got conferences and documents, all sorts of things there. And you can certainly, as an organization, if you want us to publicize some information, then you can certainly let us know about it as well. We can do that for you. So if top 10 CEOs, hospital issues facing hospital CEOs, there we go. That was a discussion, a webinar we had in December, so we're filling up that discussion area. And here's the Citizens Guide to Health Indicators. And this is going to be our discussion space. So what you would do, just to make that very clear, is you would click over here on the left-hand side of the page. And so you would, when you log in, you would click on the lounge area at the top here, and then you would go down here and you click on a Citizen's Guide to Indicators. And I think what we're going to do is we're going to provide some videos on the homepage of the site, so before you've logged information and some discussions. And we have some excellent contributors for this discussion group, and I'm sure Alan, unfortunately we weren't able to have him participate verbally in this call. However, I'm sure that we'll get some interesting comments from him in a written format, and certainly the questions that were asked that we did not get to, we're going to post them here, and this is how we would do this sort of thing. What I'd suggest is actually not doing it like that, but actually put the question up here in the subject heading where you would, and in the body you can repeat it, and then people will see very clearly that you've asked a question. So in this case, we're replying to a discussion that's already been started. So we would have a question, we'd click on the reply button when we see the question, we click on reply, then we type in our reply, and then we add the reply right here. So that was a very quick run through, but I had to make it fast because I'm concerned about people's time here. you can certainly contact me, and you can contact our team if you want to learn a little bit more about how this is going to operate. And John, do you have any final words for the folks?
Around the guide and how we can improve on it, and really the issues that are uppermost in your mind when it comes to the use of health indicators, because we can share that with many others, particularly Health Canada, CIHI, and Stats Canada, as they undertake their work as well. So, Tom, I want to thank you and the Community for Excellence in Health Governance for mounting this particular seminar today. So thanks for all your work.
Well, our pleasure, and thank you very much for the opportunity to do this. It's certainly greatly appreciated. And I see that we do have a question, which was, would you be logging on to help facilitate the discussions? And we are going to set up the site so that John will receive email notifications, and that's a terrific feature. When you go to this space, you'll see on the right-hand side under Actions, it says as an option, Receive Email Notifications. I strongly encourage you to activate that. And if you activate it, then you'll be notified when people do make posts and such. And you can actually reply right from your email browser, where you hit reply, you type in your message, and you click on send, and magically it will get posted to the same discussion area on the site. So it's a wonderful feature, and John will be participating in that. So thank you everybody. And I see, Carl, we didn't get to your question, but we are going to post these. So thanks everybody, and we look forward to seeing you online. Bye bye.